Hello, everyone. My name is Fatma Iqbal. I am a board certified obesity medicine specialist as well as specializing in internal medicine. Um, Today's podcast, we're going to talk about the impact of obesity on your health. This is a two-part series. So, for the first part, we're going to discuss about how obesity is impacting your blood pressure, the risk for stroke, diabetes, and heart disease, and several other factors. So, let's get started. As far as obesity is concerned and how it is measured, it is very important to understand the BMI that you fall within. So a BMI of 25 to almost 30 is considered a overweight category, basically, and anything less than 25 is considered a normal BMI, of course, with some variations having a underweight category as well. Over 30 BMI is where it is considered obese. And this metric is used not just in the United States, but it's also used worldwide as well. So BMI is sort of an indirect method of assessing obesity. However, it is not a very accurate method in certain groups, such as your athletes and your elderly. So it's always a good idea that when we are measuring, or if you are assessing a BMI, that if you are someone who is quite athletic or if you are on the older side, then it's always advised to add on the waist circumference as well to assess the BMI. And of course, this is considered something that is important that is done by the obesity specialist as opposed to your general primary care doctor's office, where more accurate measures are taken to measure the BMI. So let's talk a little bit about the prevalence of obesity. The statistics that I have within the United States between 2011 to 2014, about 56% of Black women were considered obese, and 38% of Black men were considered obese. Also, around 35% of white women were considered obese, and 34% of white men considered obese. This number is higher in the Hispanic population, so about 46% in Hispanic women and 40% in Hispanic men. So, comparatively, if you see, the rates of obesity are higher among blacks than they are among whites. And among the Hispanic women, that is also a rising rate of obesity among them as well. Furthermore, studies also found that obesity rates are much higher in people that are above those that are above the poverty line. And as you go below the poverty line, that number reduces as well. So those that are better off or in better socioeconomic status tend to have lower rates of obesity as opposed to those that are um, considered above the poverty line. And this number is also true for children that are between the ages of 2 to 19. Um, it is concluded that in a 2016 study that young children, around 17% of them between the ages of 2 to 19, are on the obesity BMI category. So again, this study was in 2016. Due to the increased awareness among the pediatric population, this number has sort of leveled off now, but it continues to rise with age, especially in the 12 to 19 or the teenager category. Since 1975, the global obesity rates have been steadily increasing, in which both obesity is considered a BMI over 30, and severe obesity, which is a BMI crossing greater than 35. So both the rates of obesity and severe obesity have been steadily increasing since 1975. Another important aspect to recognize is the death rates by obesity. So studies have shown that in the overweight category, which is between the BMI of 25 to 30, the survival time is reduced by 1 to 2 years. Now, as we go to class 1 obesity, which is BMI of 30 to 35, this time or survival time is reduced by 2 to 4 years. And then moving on to class 3 obesity, which is a BMI greater than 40, significantly reduces the survival time to 8 to 10 years. So, very important to understand how obesity is reducing the survival of our patients um, and people in general when they discuss. We talk about obesity in our primary care offices. It is quite a significant decline, and they sort of correlate with the survival time or the effects of it, similar to smoking, how smoking reduces survival time. So it comes kind of in the same category, even though we take smoking quite seriously in our medical practices. I think obesity is something that is not looked at with an equal eye, if anything. So this needs to change as we look at these studies. Now, early life increases in BMI is also playing a part in early rise in chronic health diseases and mortality. So that is something that should also be considered as we are seeing higher BMIs among the younger population. The chronic diseases are increasing and the survival time is decreasing as well. Heart disease is something that is quite common and a leading cause of death in the United States, around 24%, which is a very high number. Studies, particularly cohort studies, have shown a direct linear relationship, which means a direct relationship with increasing BMI, which increases the rate of heart disease. And this risk increases significantly among the overweight. And the risk kind of starts at the BMI of 25. So we consider overweight to be past the BMI of 25. And that's where your risk of heart diseases goes up. Uh, the Million Women study in the United Kingdom, it followed over 1 million female patients between the ages of 55 to 74, and they found out that the risk of heart disease increased directly because of increasing BMI between 20 to 34. However, the risk doubled at the higher end of the BMI curve. So the higher the BMI, the higher the risk, or doubling of the risk. So the risks of heart disease tend to be higher in women. In young adults, which was a Harvard study in 1922 to 1935, it found out that the death rates among the teens who were considered overweight was twice as likely from heart disease than their peers. So overweight teens tend to have a higher death rate than their peers, or higher rate of heart disease than their uh, peers. So heart disease is indirectly related to type 2 diabetes, hypertension, increased cholesterol. So all these factors increase heart disease, and body inflammation, as well as sleep apnea increases the risk of heart disease. And so those are important considerations when we talk about heart disease and how it is related towards obesity. Another important cause of death in the United States, which is the fifth leading cause of death, is stroke. Many studies have showed that being overweight and obese are important risk factors for ischemic stroke, which is stroke secondary to not having enough blood supply to a certain area of the brain. But the similar relationship was not found when it came to hemorrhagic stroke, or basically leakage of blood, or having blood within the brain. So two different factors here. Ischemic stroke did had a relationship with being overweight and obese, and hemorrhagic stroke relationship was not necessarily established with the studies. So let's talk about how blood pressure is affected by obesity. So in the United States, almost 30% of adults are affected by high blood pressure, among which only 50% have any good control on their blood pressure. So blood pressure is not just linked to increased risk of heart disease and stroke, but also heart failure. So studies are showing that Even when the BMI is within the normal range, that is less than 25, there is a steady increase in the blood pressure. However, it is important to note with every 1 unit rise in the BMI, the risk increases almost 12% for hypertension. So as the BMI continues to climb, the risk of hypertension also increases. Lastly, we're going to talk about type 2 diabetes and the risk of diabetes, how it increases with obesity. Diabetes is the seventh leading cause of death in the United States, leads to chronic inflammation, insulin resistance, and cell stress. The risk of diabetes is not just higher in obese men and women, but also with those whose BMI is along the upper end of the normal range. So normal range being 20 to almost 25. So anyone along that upper range would have a higher risk of developing diabetes. So in 2009, a meta-analysis study which studied the risk of type 2 diabetes showed that in men and women who went from an overweight BMI, which is a BMI between 25 to 30, went to an obesity BMI over 30, they had double the risk of developing diabetes. And similarly, the risk found in a nurse's study tend to begin in a BMI range between 21 to 23. So even on the earlier um, uh, spectrum of BMIs, which is the normal spectrum, the risk of diabetes is there, but is stronger as the BMI tends to go up. In a Harvard study of males, those with initially low BMI, less than 21 in adulthood, uh, increasing the BMI almost up to 2 units over a decade nearly doubled the risk of diabetes. So studies after studies shows how the risk of diabetes actually increases with increase of the BMI. Similarly goes for the waist circumference. In women who had larger waist circumference, which is around 36.2 inches, they were more than 5 times more likely to develop type 2 diabetes regardless of their BMI. So central adiposity is also a risk factor for the development of diabetes. So not just the BMI alone, independent of weight, studies show that the increasing waist circumference, particularly central adiposity, increase in waist circumference, was leading to 5 times more likely to develop type 2 diabetes. So these are some important aspects to consider when considering the risk of obesity with type 2 diabetes. I want to thank you very much for listening to this podcast. Stay tuned for the second part of this lecture series about the devastating impact of obesity on chronic diseases. Next, we're going to talk about how obesity is related to development of cancers, as well as infertility and liver disease. Please go to my website for detailed information about my presentations. It's www.fatimaiqbalmd.com, where you can get more in-depth analysis, more articles to read, and better understanding about the disease of obesity. I thank you very much.